Welcome to a Court Blog live coverage where we'll be witnessing a momentous occasion in the healthcare sector of Nigeria. Today, the Honorable Minister of State for Health and Social Welfare will be paying a visit to the Federal Medical Center of Abeokuta. He would also be taking part in the 105th meeting organized by the medical directors of the hospital. So stay tuned as we provide you with exclusive insight of this historical milestone in the healthcare sector. I am Adan Maumari, reporting for a Court Blog. In a historical event held at the Federal Medical Center Abeokuta, the stage was set for a pivotal moment in Nigeria's healthcare trajectory.
Prime Minister sir, you are welcome to this great institution, Federal Medical Center, Abeokuta. It's a day of joy having you with us this morning, sir. We thank God for journey mercies, which God granted you to this place.
Direct our course, let our leaders guide, ever you the truth to know, in love and honesty to grow, and living just and true, great love the Christ attained, to build a nation, where peace and justice will reign.
My great pleasure to welcome you all to this occasion. This auspicious event marks a historic third time since I assumed office as the Medical Director of Federal Medical Center Abeokuta more than 6 years ago that distinguished guests and stakeholders in the health sector within and outside the state will converge in this hall for the commissioning of projects in this center. Precisely, on 22nd of March 2021, the Chief of Staff to the President, Right Honorable Femi Gbajabiamila, the Speaker of House of Representatives then, along with some other distinguished dignitaries, converged in this same venue, commissioning of the President Muhammadu Buhari International Conference Center and Telemedicine Hall, gymnastics, physiotherapy center, 4-wing building complex, our pharmacy complex, oxygen plant, and millions of equipment, medical equipment we bought in this center. This was commissioned in 2021. The Honorable Mr. Sir, it is also my pleasure to inform you that this hospital has been ranked very high by Savicom Presidency, both in 2020 and 2022.
We humbly appeal, sir, for an urgent intervention for power generation in our various hospitals. Like Professor Musa said, if you give us power alone, what you're going to see is a quantum leap in the quality of healthcare services. Now, even those of us who have achieved and tried to achieve power, sir, we are owing hundreds of millions to the various discos and diesel suppliers. What we are begging for right now, sir, is an intervention to help us pay. Many of us are being taken to, to police stations because of huge debts that we did not embezzle. Please, we're asking for that. We're also asking for assistance in the payment of the backlog owed to the vendors of the outsourced services. These things had been, tabulated and captured. Some money was released. After that, nothing else came. They are still disturbing us all the time. We also continue, sir, to advocate for the establishment of a tertiary healthcare development fund, akin to the Tertiary Education Trust Fund, TED Fund. We need something like that in the tertiary healthcare sector for intervention in our tertiary hospitals. The establishment of this fund, sir, will perennially help to address the infrastructure, equipment, and technology gaps in our tertiary hospitals, as well as provision of funding for training and research. So we also appeal for some funding from the Basic Healthcare Provision Fund for the provision of facilities and treatment of emergency cases within our hospitals. We are the ones that bear the brunt of emergency care in this country. So, sir, we are pleading that a small percentage of that 5% can be given to us to help offset. Many of these patients that come in, brought in accident cases, are indigent. Nobody, but they are forced to spend huge sums of money attending to them. Once again, sir, we want to thank you, and the committee congratulates the management and the staff of FMC Abeokuta.
Let me talk about the minister himself. The Alausa family and I mean, we are like a family. In Ijebode, when I was working there, 1963 to 67, when I heard Tunji Alausa, I said, that must be one of my sons. Now, there's a lot I can talk about. And when somebody spoke about Abia State, I said Abia State is one of the greatest states in Nigeria, because my son Owu Kakalo is from Abriba, and I'm a native of Abriba as well. So, because when he was to be installed as the Okuzu of Abriba, I was the chief guest of honor, and that was 1989. So few years ago. So, Honorable Minister, it's a pleasure to have you here. Look, everybody will always ask government to do this, to do that. But government too must work for this money. Money that government spends comes from taxes and other sources. That Nigerians don't pay taxes. Then we keep on asking government to do so many things for us. There's no way government can cope. We, all of you, chief medical directors, please try and get people, there's so many rich Nigerians. Try and speak to them the way this my son has done. Let them come in to build walls, do so many things. Some of the equipment they've been advertising, I can tell you that private individuals can also buy this equipment for the hospitals. So please don't burden the government a lot. I'm not. This should come from the minister himself. But I have been in government in so many capacities, and I can talk on behalf of government. We will always want to depend on government, and we shouldn't really do so. Now, I've been asked to be the acting chairman of this ceremony. It's always a pleasure for me to go out of my house. I don't go out a lot, because when you get to a young age of 92, you don't want to go out too often, because one of the greatest risks young people of my age face is falls. You don't want to fall, because to fall is almost death. So we don't go out a lot, and to bring me here today, I think I should be thanking my son here for bringing me out.
I will briefly, like I said, I'll just random. You can read the thing later. I'm going to talk about security, because that's my area. Then towards the end of the thing, I will put something about medical there, because that's what the prof said I must add to it. I said security is perhaps the most talked about subject matter today all over the world. This is because every other human activity depends largely on whether the environment in which man operates or carrying out his duty is secure or not, or whether it is peaceful or turbulent. I try to do some conceptual clarification so that if the professors, my teachers, if they are here, they will know that at least I didn't remember that thing they taught me. So I'll just put a little academic area, but I will not take your time. The state of being open to danger, threat, fear, and lack of protection, that is insecurity. Like never before, insecurity in Nigeria has gone really, really beyond imagination of some of us patriotic Nigerians. And every effort is being made to nip this thing in the bud. With its roots in political, religious, socio-economic, and ethnic factors, insecurity in Nigeria, according to Bill 2015, has been a major challenge to the Nigerian government in recent times. We all know what happened. Activities of Boko Haram, bomb attacks, gunmen, and so on. Cattle rustling, brigandage, banditry, all over, that has been happening all over the place. Chapter 2, subsection 14, subsection 2 of the Nigerian Constitution, as amended, is emphatic on the fundamental roles and objectives of any government and the state policy, that the security and the welfare of the people shall be the primary purpose of government. By this, the security of life and property of the Nigerian citizen is a sine qua non. Despite this huge responsibility between the government, the Nigerian police, which is saddled with the sole responsibility of carrying out this fundamental responsibility, is seriously overwhelmed and have been unable to meet up with this onerous task. I went on the concept of security. Security has so many definitions, but it can be best described as a situation of general apprehension of fear, crime, and general disequilibrium of social and political and economic and religious activity. Once there is problem with security, once there is insecurity, all other aspects of it will suffer, because it is the foundation on which everything is built on. Let me quickly go to medicine and legal issues. That is the area the prof said I must mention. I said medicine, like all human endeavors, is governed by coded rules and procedures. The first responsibility of a medical personnel is to secure the lives of patients and sick persons generally. It is a priority matter. Just like government in the Constitution must guarantee the lives and properties of citizens, the medical world must guarantee the well-being of patients assigned to their care. Now, the legal position is that a patient with gunshot wound, whether he shot himself, is legally entitled to immediate and unconditional medical attention. Whoever denies him that attention may be guilty of criminal negligence and may be more serious if the patient should die in the process of arguing whether there's a paper or no paper. The patient with a gunshot wound must be treated immediately. It will be criminal irony if a doctor should disobey his allegiance to that oath by pleading any impediment. In fact, he must push aside any threat or obstacle that will prevent him from discharging that security, life-saving duty. And I want to address this to my old colleague, police officer. There is no law anywhere in our book that says a wounded person must have a paper before he can get treated. And there is no law, there is no way in our law that says a wounded person should be paraded for the press. If you are an accountant, I was a police officer for 32 years, and I worked especially in every part of the area. A wounded suspect in any encounter with the law should be taken directly to the hospital, not police press parade ground. To take somebody with the gunshot wound straight to the journalist, this is wrong, it's illegal, and it's unconventional. wound must be taken to the hospital. And I rather than saying, even Notorious Adini, was treated as a gunshot wound before his trial and subsequent execution. I was in Benin during that period. I was in the team that arrested him under our Akakoso. Kasma Akakoso was the leader of the team during that period. Gambo was the IG. Even when the man was arrested, he was shot in the process, but he was taken to the hospital, not to the paragraph. It was after he was treated by a leg, one of the leg was amputated, but he was still treated and he went through the normal one. No law, therefore, asked the doctor to demand for police report when a good or even a bad Samaritan brings any suspect to the hospital. No such law exists everywhere. When a person is brought to the hospital with gunshot wound, there should be no excuse. There should be no question. You have to save that life. You have to secure that life. It is a responsibility. And if anybody tries to impede it, you should brush that person aside. Because if the person dies in the process, you will be charged for criminal accident. So that controversy is not there, and it should not be there. And I'm saying in all the efforts that I'm from as a lawyer, and I'm no policeman, that there's no such law anywhere. That anybody that's been wounded.
The Minister of State for Health and Social Welfare, Tunji Alausa, stood before a gathering of esteemed medical professionals at the 105th meeting of the Committee of Chief Medical Directors, unveiling an ambitious vision for the nation's healthcare system. Against the backdrop of pressing challenges and unmet needs, Minister Alausa articulated a comprehensive four-pillar agenda aimed at reshaping Nigeria's healthcare landscape. These pillars centered on effective governance, equitable healthcare delivery, improved health outcomes, and the unlocking of economic potential within the healthcare value chain, underscored a commitment to transformative change. Amidst the sea of medical directors grappling with the complexities of their roles, Minister Alausa commended their unwavering dedication and invaluable contributions to serving the Nigerian populace with quality healthcare services. Recognizing the imperative for standardized care delivery, he announced the formation of the National Health Institution Standards Committee, poised to uphold and enforce care delivery standards across the nation's healthcare institutions. In a bold leap towards technological modernization, Minister Alausa unveiled plans for a sweeping digitalization initiative. A dedicated committee was tasked with evaluating and executing the full-scale digitalization of processes within the healthcare facilities nationwide, heralding a new era of efficiency and innovation in the sector. As Nigeria embarks on this transformative journey, poised at the intersection of tradition and progress, the nation's healthcare landscape stands on the brink of profound change.
Distinguished ladies and gentlemen, I'm quite honored to address you today as we gather to discuss the critical issues facing our healthcare system. As heads of our federal tertiary hospitals, you play a pivotal role in ensuring the health and well-being of our citizens. Our mandate is clear: to build an effective governance framework that fosters efficiency, equity, and quality throughout the healthcare system. Let me begin by thanking each and every one of you for the tremendous work you have been doing and continue to do in providing good health care to our citizens, which is in line with Mr. President Bola Ahmed Tinubu, GCFR passion, desire, and promise to deliver quality and affordable health care to all Nigerians. Like I have often said in many fora, it is the federal tertiary hospital that have kept this Nigerian health system alive and afloat. Without the federal hospitals under your leadership, our healthcare delivery system would have been in much more worse. I thank you for this, and the nation is grateful to you. I think you all deserve appreciation from our citizens and a big round of applause. Please give them a big round of applause. All of you have tenured appointments, which give you the liberty to discharge your duties without fear or favor. However, this comes with a high sense of responsibility, ethics, and standards. You must remain disciplined, maintain peace, harmony among the various health professionals within your various institutions, and you must be innovative in your approach to resolving conflicts. However, your tenured appointments are not absolute. Mr. President appoints you on recommendation and can also suspend or terminate your appointment on recommendation as well. I need you to note that. This is to let you know that you cannot rest on your horse, but always strive to do better. The ministers, permanent secretaries, and directors in the Ministry of Health are all here to assist you to succeed. Know your limits as chief executive and seek guidance and clarifications where necessary. Do not carry unnecessary burden upon yourselves. As ministry is big enough to make your load lighter to carry. As you're all aware by now, the ministry strategy blueprint to move the healthcare sector forward within the next 4 years is a 4-point agenda, 4 pillars that we've drawn out. Effective governance, efficient, equitable, and quality health system, improving our population health outcomes, unlocking our healthcare value chain, and health security, looking at health beyond physical security, but as part of our social security and national security. The second pillar is essentially to strengthen our health system and position them for better healthcare service delivery. It aims to strengthen prevention to primary care, improve quality of care across public and private healthcare service delivery at every point, amongst others. The third pillar, unlocking the value chain, recognizes healthcare as a business that can stimulate employment and add to our GDP positively. For instance, in the United States, healthcare contributes about 23.5% of the GDP, and this translates into $3.3 trillion in annual spend. We want to get to a point that our healthcare sector move from consuming part of our economy to be part of the growth driver of the economy, so that year over year, we can at least move our healthcare as a contributor to our GDP from current abysmally low 5% to about 15 to 20% in the succeeding years. The fourth pillar, of course, is health security. We will improve our ability to detect, prevent, and respond to public health threats and build resilience in our health system in collaboration with other sectors to safeguard health of all Nigerians. We prioritize health security to protect our nation from emerging threats and pandemic. This requires proactive measures to strengthen our healthcare infrastructure, enhance surveillance, and improve emergency responses. To achieve these goals, in other words, the enablers of achieving a 5-point pillar agenda, will focus on several key areas. First and foremost, we will prioritize implementation of data and digitalization initiatives. By harnessing the power of technology, we can improve decision-making, enhance patient care, and streamline administrative processes. As you must have seen in the budget, a massive digitalization program is coming. A committee has been set up that will be inaugurated next week to implement the full digitalization of our processes in our healthcare facilities across the country including our primary health care centers. The subnational government would be encouraged to key into this project as we move along. Secondly, we will commit to increasing and effectively managing financing of healthcare. Adequate funding is essential to provide resources needed to deliver quality care to Nigerians, regardless of their socio-economic status. The mandate of the president is the mandate for the entire country of Nigeria. This president campaigned during his campaign that he's going to come in to fix this country. He made honest campaign promises, and 9 months after his presidency, the president is living up to his campaign promises. He's taking difficult decisions that no past presidents have been able to take in the last 43 years. So this president wants to put this country, Nigeria, our country, his country, on the path of sustainable growth decades from now. And that's why the president has made the choices he made when he came in. And the choices he's going to continue to make. Now, let me answer your question. The mandate of the president to us as superintendent minister and the Ministry of Health. The president told us one thing. He wants every single citizen of Nigeria to be entitled to meaningful and comprehensive health care. And he wants us to meet the goal of universal health coverage to every single citizen of Nigeria. The demand of the president on us is high, but what the president has done as well is to give us, he has given us the maximum support we need at the Ministry of Health to carry out his mandate. We're working for the president, and through him, we're working for Nigeria. And the president, this is the first president in our country that has put healthcare on the front burner. The president has said it himself several times, and just not saying the president's meeting is saying with full actions. The first time in the history of our country, we have the highest budgetary allocation to our Ministry of Health. And this money, the president has mandated us to spend it to improve infrastructure in our hospitals, to improve infrastructures in our primary healthcare centers, where care can be brought closer to the people of the community, and also to modernize our hospitals, our primary healthcare centers with state-of-the-art equipment. The president is also working on comprehensive package, welfare package for healthcare workers, and more so the entire workers in the country. So I'm asking Nigerians to give the president some time. We will start seeing the benefits of the difficult decisions the president has taken. In fact, this is extremely impressive. This committee of CMDs and medical directors have been meeting for 24 years. 26 years. This shows the temerity, the dedication of their intention to the country. They meet, they share ideas, they do peer review, and I'll tell you, the country is a benefactor of this meeting. Let me tell you why I said that. Today, I'm so proud, and I've said it over and over and over. Our federal tertiary hospitals saved our healthcare system from collapsing. Our medical directors and chief medical directors, our teaching hospital and our medical centers and our specialist hospitals, they're providing good quality care at significant discount to our citizens. Go to any of our hospitals now, they have ICU, they have diagnostic centers, X-ray, CT scan, ultrasound. And this is a manifestation of government investment in our healthcare system. The care our citizens are receiving in a federal tertiary hospital is comparable to any of the care you'll get anywhere in the world. So I'm using this media to congratulate our chief medical directors and medical directors on the hard work that they are doing, their dedication to serving our country and to serving humanity. And now also, as I sat in this meeting with them, I was so moved, and I was beginning to think, how can we even get a various state hospital to have a committee like this? Because it gives them the platform to share ideas, to talk about what each and every one of them is doing well, their problems, how they can collegially, in a peer review format, talk about it, discuss it, and come up with solutions on how they can individually improve the services at their various hospitals. The take-home for the meeting is just that they should continue to do what they're doing. They're doing well. You see them, Professor Musa Olomu, the medical director of the Federal Medical Center, Abeokuta, is hosting this meeting. Look at all our MD clad in amazing attire, adire, well-dressed, happy, and the collegiality amongst them. They joke about each other. They're throwing out friendly, competitive endeavors among them. I'm better. I should be better. I'm this. And that's what you want. You don't want, this is a healthy competition. And guess what? As they continue to do this, guess who benefits? Our country, our citizens of Nigeria benefit from that. So the take-home message is for them to continue to show this camaraderie to themselves, amongst themselves, and continue to do what they're doing. They're doing well, and we at the Federal Ministry of Health, we will continue to support them. The President is supporting them via his interest, his passion, and his commitment to the healthcare, to improving, rejigging, overhauling, revitalizing a healthcare delivery system of Nigeria. And I want to take this opportunity, to use this opportunity to thank the President on behalf of Nigerians for what he's doing for us, okay? And I'm going to tell you the way I feel. I moved around. When I first came in, I was very impressed with the campus. And now moving around got me so impressed. And this is a testament to the way we should be cared for. Our citizens should be cared for. This hospital and many of our federal medical centers and teaching hospitals and specialist hospitals, they're doing a phenomenal job in improving the care that we deliver as a government, as a country, to our citizens. Professor Adewale Musa Olomu, the medical director of this hospital, is doing a phenomenal job. And I'll tell you the test of a good leader. I looked around, all his staff, they were all happy, praying for him, thanking him. That is a reflection. That is a judgment of a good leader, of a good administrator. I thank you on behalf of the government for what you're doing here. And I also want other medical directors to emulate what Professor Musa Olomu is doing. And actually, if I say emulate, it's like I'm stretching the truth. They're already doing things like this as well. Many projects. I tell you, this president is committed to revamping this country, and he's meeting his words, his campaign promises with actions. You just heard, just 2 weeks ago, the president gave approval for us to build 6 new cancer centers in each of the 6 geopolitical zones in the country, as well as build 12 diagnostic centers around the country. And The president has said much recently, our regulatory bodies, the Medical and Dental Council, Nigerian Nursing Council, Pharmaceutical Council, were being defunded. They were being defunded by the government. We made presentation to the president. The president did not even say anything. He said, return the funding to them. So this president, anything about healthcare, we get a yes answer from Mr. President, President Bola Ahmed Tinubu. And I'm telling you, it's not only healthcare. This president comes to the other part of the economy, is working almost 16 to 18 hours a day, working for this country. That's why I'm asking Nigerians, please be patient with our president, President Bola Ahmed Tinubu. Our country is on the right trajectory. The fundamentals are being built. They are being built in a robust manner that will stand the test of time in a sustainable way. Decades to come, Nigerians, our current generation, future generation to come, our grandchildren will be the beneficiary of the bold step, bold decision this president, President Bola Ahmed Tinubu, has taken. Thank you.
I would say the major problem is financing, healthcare financing. The high cost of healthcare in the country, and considering the current economic conditions, the socio-economic conditions in the country now, people's finances are down, prices of things are going up, including healthcare. Price of medications, price of healthcare generally is going up. So it's a major challenge for us, especially in the hospitals. You see people bringing their relations to hospital, and the next thing they disappear. They leave their relations in the hospital and to the healthcare professionals to treat. So you see that you have to use a lot of resources from the hospital to manage people, and this treatment is not even paid for. Yeah. So that is one. And what I would advise is that people should embrace health insurance. Health insurance, both at the national level and even at the state level. And I know that some local governments already have their health insurance schemes. So if people can buy into it, it will go a long way in helping the financing of healthcare when they fall sick. So that's it. Then government should also put more funds into healthcare financing.
Definitely the major things you notice in hospitals is that most patients are poor and can't afford to pay their bills. So that's why everyone who is interested in healthcare financing is always talking about our increasing scope of health insurance, so that both the informal sector and the formal sector can be insured, so that you don't need to come with cash to the hospitals to pay for your healthcare services. Once you come, insurance will take care of it. So that's what we think we're advocating, apart from the fact that people should be encouraged to increase their income and be able to afford things like healthcare. Yes, Professor Olomu of FMC Abeokuta has done a lot, and you can see all the projects commissioned by the minister. Obviously, that will increase access to tertiary healthcare, which is supposed to, and of course, do some form of secondary and some form of primary. And I'm sure the Ogun State governor is doing a lot as regards primary healthcare. So the load on him will reduce, and he will concentrate more on those tertiary healthcare services for which the hospital was established. You heard him say about their starting open heart surgery. That's something commendable. That's where we should be going to. And if it doesn't increase his capacity in terms of infrastructure and equipment, he can be able to do such high-tech healthcare service delivery like open heart surgery. So we're happy with him, and we hope that he will continue in that trajectory.
Well, as you have heard during the lecture and the celebration today, government needs to mobilize more resources. Adequate health funding is very, very sacrosanct. The public-private partnership too should be encouraged to make healthcare facilities accessible and affordable for the common masses. So individual philanthropists also can help so that the less privileged in the society can access care whenever it is important for them to do so. See, each project that our commission is made for particular specialty. Like we commission the isolation center, and that we cater for infectious diseases like Lassa fever, COVID-19, Ebola, all manners of hemorrhagic diseases. We have also gone to commission the building that accommodates finance officers, procurement officers, and audit officers. That is to enhance their performances. When you have human resources and you could not give them accommodation, provide tools and facilities for them to work, it's a problem. You will not get output. So you can see that a building was commissioned for those category of staff. We are also going to commission ICU, and that is intensive care unit for those who are in critical condition, who need intensive care. So each project that is being commissioned is for a purpose. They commissioned the molecular lab for laboratory scientists to carry out all manner of tests. You know, in health system, it's a teamwork. When the doctors see and diagnose, the laboratory carry out the test, the pharmacists prescribe the drug, the nurses implement their order. So for each of the facilities, a function is attached.
Of course, it will definitely make our work more efficient. In fact, before going to the issue of making work more efficient, let's talk about employment. You know, more nurses will be employed because 100 beds are part of what is being commissioned today. New ICU, new isolation units, and you know, nurses and doctors and other health practitioners are going to be employed to work in all these facilities. So it's going to enhance our work. It's going to make our work more good and more environable to the Ogun State and its environs people. Of course, a lot. You know, our Professor Musolomu is an achievable, is a go-getter, is a good leader. So as we are commissioning this today, so many others are ongoing. A lot of projects are ongoing. If you can go around the premises, you will see a lot that are still ongoing, that are yet to be commissioned.
Today, 180-bedded hospital is being commissioned. Our isolation units is being commissioned. The ARD section is being commissioned, and the new ICU ward is being commissioned. So definitely it will give us enough space and enough equipment to work with. So it will enhance our work. As a nurse, by giving out the needed and necessary health care, by giving prompt attention to our patients, especially when new facilities are being commissioned for new equipment being given to us, so it will empower us to deliver efficiently.
Thank you for joining us on this significant event, which undoubtedly showcases the resilience and the indisputable significance of the healthcare sector in Nigeria. To stay connected with us, follow us on all our social media platforms and subscribe to our YouTube channel. I am Adanma Hamairi. Many thanks for watching.